We're often asked, of course, in the work that we do, whether a person's weight is really a problem or not. And often we reflect back on BMI as something really important. And I've heard it said, well, BMI isn't valid at all. Well, not quite. It's it's a ballpark of something for sure. BMI really reflects your weight in relation to your height. So if you're 6'5" and 200 pounds, you're probably pretty lean. But if you're 4'2" and you're 200 pounds, you probably have some pretty serious health problems related to your weight. So BMI at the extreme is obviously generally of concern, but it depends. It depends on you as a person, and it has a lot of variables involved. For instance, in my case, I was born probably to a mom with uncontrolled type 2 diabetes, and I was overweight as a baby. I mean, like 12 pounds when I was born. And I had a lot of health problems growing up, and I was born with a defective heart and on and on. And so for me, I have to keep my BMI well under 25 to avoid seeing clear signs of prediabetes. So it's very different than a lot of people we see in our clinic that have a BMI maybe of 30 or even 35, and they seem for all intents and purposes to be quite healthy. So really, what's the difference, and why would someone like me need to be a lot slimmer than someone who is maybe able to carry a lot more weight? Well, some of it has to do with epigenetics. That's switches in your genome that are turned on or off depending on, for instance, your early environment, even the environment in utero as you're developing as a fetus, and early childhood and so on. And I consider my epigenetics were probably not so great. But on the other hand, in some cases, people carry quite a bit of extra weight, and the weight is not seeming to do any harm at all. The difference generally will lie in the amount of fat inside their belly compared to the amount of fat that they can pinch. Fat that you can pinch, what we call subcutaneous fat, is fat that generally is metabolically pretty neutral. In fact, there's pretty good evidence that subcutaneous fat, the fat that's under your skin, not inside your organs or in your muscles or in your liver, but the fat that's under your skin, is actually metabolically beneficial to an extent. I mean, if you're carrying 200 or 300 extra pounds, then the mechanical burden of carrying that weight around becomes a serious issue as well. But for the most part, people that are carrying some extra weight and the weight is primarily subcutaneous, that fat is actually, in many ways, a good fat. It's a fat that helps you absorb excessive fatty acids after meals, for instance. It's a reservoir for additional calories. On the other hand, visceral fat is very different. That's the fat that is inside your belly, around your organs, and it's also fat you might call metastatic fat. It's the fat that starts to occur when the visceral fat expands and it sends out compounds we call adipokines. These are inflammatory substances like IL-6, tumor necrosis factor alpha, TNF-alpha, and so on, and where we see things like leptin resistance and lowering of adipokine. These are all changes that occur because the fat inside your belly, the fat cells transform into something that becomes a powerful liberator of endocrine substances, hormone-like substances that have a tremendous effect on inflammation, on appetite, on blood sugar regulation, and so on. It even have neurological effects and things like that. So visceral fat is really the main driver of problems related to obesity. And it's really where that fat is distributed that's important. And that's where the difference between men and women become often very clear. Women tend to have what we call gynecoid distribution of fat mostly, especially in the younger years, where the fat is predominantly the breasts, the buttocks, the hips, the thighs. Maybe you don't like that fat, but that fat is actually relatively harmless. It's when you start to accumulate more fat inside the belly. And the evidence of that in a woman would be, for instance, early in life, you start developing, as a young adult, some acne, and you maybe start having irregular periods. That's a pretty good sign you might have PCOS, which is a condition that has to do with the shift towards more male hormone versus female hormone. And that's, again, what happens closer to menopause. There's a change in the ratio between estrogen and testosterone, or the derivatives of those hormones, so that as a woman approaches menopause, her hormone profile starts to be more like a man. And it's that hormone profile that seems to be, to a large extent, that tends to make it more likely that when a man gains weight, he's going to gain weight inside the belly, in the liver, in the pancreas, in the muscles. Just like a well-marbled steak, an individual that gains more visceral fat is going to have well-marbled muscles and a lot of fat around the heart. And then fat inside the arterial wall, for instance, starts to be a problem because of that as well. So it's a situation where if you have excessive visceral fat, that's really where the problem arises. Well, how do you know if you have too much visceral fat or not? Well, research suggests that most people can tolerate a certain amount of visceral fat, and then past a certain critical threshold of visceral adipose tissue mass, above that critical value, the visceral fat tissue itself starts to transform into more of a liberator of inflammation, and where you start to see this shift towards changes in appetite regulation and blood sugar regulation and more pain and stiffness. It's really where the aging process is starting to accelerate because of this fat distribution. A good sign of that is where you see an increase in the circumference around your waist. So in some cases, individuals may not have much increase in weight on the scale, but they have an increase in weight inside the belly. And that's sometimes what we'll see is that individuals don't have that high a BMI, but when their visceral fat increases just a little bit, they start to develop the signs and symptoms of type 2 diabetes. And I'm one of those people, a little bit too much visceral fat, and I start getting all the signs and symptoms of type 2 diabetes. And that's, shows up on blood tests where you can see, for instance, your fasting sugar might be elevated, but it would be more that your after meal blood sugar starts to surge more and your insulin starts to surge after meals. And even your fasting insulin is higher than ideal. If you were to look closer, it's hard to do these tests. You could do them in research, but you'd see an elevation in certain substances like IL-6 or TNF-alpha. These are inflammatory compounds. We call them adipokines because they come from the fat. If you could measure it, you'd see that there would be the onset of leptin resistance, and you'd probably see elevated ghrelin levels that would persist between meals. And so what you're seeing is a situation where as you gain weight, it's like your body wants more weight. It starts to create insulin resistance and a problem with keeping your appetite managed. You start to not feel full with meals like you used to, and your blood sugar starts to surge, and you have these changes that lead to a lot of the problems we see that are harmful related to obesity. What does that mean? It means if you have increased visceral fat, then you're going to see a higher risk of all kinds of things. Cardiovascular disease. This is a very long-term problem. It may not start occurring until later in your life, but just be aware that decades later, you're going to be much higher risk of cardiovascular events. And eventually, old age happens. I know, because I'm coming up on 70, and it does happen. Even if you think you're going to live forever or you're going to be young forever, guess what? If you're lucky enough to live, you're going to eventually see old age coming at you. And carrying less weight into that old age is a really good idea. Not just for cardiovascular health, but for many things. Just the way you feel day to day. As you start to have increased visceral fat, there's more inflammation, and that leads to an increased sense of tiredness and exhaustion. It leads to mental fog. It leads to changes in cognition that are measurable. It leads to a higher likelihood of depression, anxiety disorders, and so on. That's been shown to be associated with increased visceral adiposity. There's an increase in the likelihood of high blood pressure, which is again driving cardiovascular risk, especially stroke. There's an increased risk of sleep apnea, which again, is like a vicious cycle. Once you develop sleep apnea, your sleep gets worsened, your inflammation gets worse, obesity tends to get worse. So it's sort of like a vicious cycle. And then it drives just about every cancer risk. It's a risk for just about every cancer there is. In women, particularly breast cancer, in men, prostate cancer, but you could say across the board, pretty well every cancer is increased in risk with obesity. And on and on. There's probably 400 different medical conditions that have been associated with obesity. And again, it's increased visceral adiposity, not just fat that you can pinch. So the main message is that if you see evidence of increased visceral adipose tissue, which is best measured through body composition analysis using DEXA, like we have in our clinic. We have a DEXA scanner in our clinic where we can literally measure the amount of visceral fat. This is something that you need to pay attention to. If you want to follow your own situation and see how you're progressing, measuring your waist circumference is probably a better measurement to see how you're doing than what you weigh on a scale. Because over time you can improve your body composition by gaining muscle and reducing fat, and in the end you're going to be healthier even if your weight doesn't change on the scale. So it's really more about what your body's composed of and where the fat is distributed than it is what your BMI is for the most part. And it is an individual thing. You might be one of those like me where just a little bit of increased belly fat and you're going to have problems, whereas others, you could get quite a bit heavier than me and still be quite healthy, especially if you've got a good diet and you're physically active and you don't smoke and so on. The lesson there is obesity is a real thing. It's a real problem. Yes, I do believe in acceptance of body acceptance, and the people should be the healthiest they should be at any size. But overall, disease acceptance is maybe something we want to try to keep people away from. Go into this with eyes wide open. Realize that there are medical concerns here, and if you want to have a healthy and productive and happy life, that weight is something to pay attention to and not to ignore, for sure.